This brief video will show you how to use the Acute Liver Failure Checklist developed by the Acute Liver Failure Study Group. The Acute Liver Failure Study Group is an NIH-funded cooperative network that was formed to study a rare disease. The study investigators, currently at 13 sites, have enrolled over 2,000 subjects since the group began in 1998. The main directions of the group include collecting prospective clinical data, serum, DNA, and tissue, facilitating numerous ancillary studies, many of which are currently in progress, and conducting therapeutic clinical trials for this often devastating orphan disease. Checklists in medicine have been shown to decrease medical error and improve standards of patient care. Well-known recent examples include the catheter-related bloodstream infection checklist developed by Johns Hopkins, which dramatically reduced the incidence of these infections, and the surgical safety checklist developed by the World Health Organization, which significantly reduced the rate of surgical complications and mortality. Acute liver failure is an ideal condition for a checklist because it requires healthcare providers to analyze and manage a highly complex syndrome under demanding and stressful conditions. The goals of the Acute Liver Failure Checklist are to improve and standardize clinical management of acute liver failure in the intensive care unit, improve the diagnostic acumen of the multiple etiologies that can cause acute liver failure, and ultimately improve patient survival. The etiology of acute liver failure is the main determinant of prognosis. Therefore, determining the cause is an important step in the management of acute liver failure. We hope the Acute Liver Failure Checklist will improve the diagnostic acumen and reduce the number of indeterminate cases. While many patients with acute liver failure survive without needing a liver transplant, many still require emergent liver transplantation or die without a transplant. We hope the Acute Liver Failure Checklist will improve outcomes of acute liver failure and increase the spontaneous survival rate. Patients with acute liver failure frequently die of multi-organ system failure, infection, intracranial hypertension, and, less commonly, from bleeding. We hope the Acute Liver Failure Checklist will improve intensive care management of acute liver failure and reduce the risk of death from these causes. Who uses the Acute Liver Failure Checklist depends on your local practice, but can include hepatologists, transplant surgeons, intensivists, fellows in hepatology, gastroenterology, surgery or critical care, residents, or nurses. You will have to decide what makes the most sense for your program and workflow. In many programs, multiple types of users will improve the management of patients with acute liver failure and optimize communication between the members of this multidisciplinary team. The Acute Liver Failure Checklist should be used when a patient is admitted to the intensive care unit and daily while the patient remains in intensive care. Let's take a look at the checklist. It is comprised of two checklists. On the left, an admission and diagnosis checklist. On the right, an admission and daily checklist. Let's take a closer look at the admission and diagnosis checklist. At the top of this checklist is a box containing tasks that should be reviewed and completed on every patient with acute liver failure at the time of admission to the intensive care unit. At the bottom of this first checklist is a table of possible causes of acute liver failure. For each etiology, there is a list of tests and tasks that should be done in all cases of acute liver failure to help confirm or exclude that diagnosis. To the right of that column is a list of diagnostic items to consider depending on your clinical suspicion in that particular patient. The last column contains therapies for the specific etiologies. Now let's take a look at the admission and daily checklist on the right. This checklist is organized by systems and should be reviewed at the time of admission. Below each system are questions about the patient's current condition. And below the questions are action items that should be done or at least considered depending on the answers to the questions. After admission, these checklists should also be used on a daily basis. The box at the top of the admission and diagnosis checklist should be reviewed and confirmed daily for all patients. The reminder list, organized by systems on the admission and daily checklist, should be reviewed daily. The time this should be reviewed depends on your program and workflow. This can be done while pre-rounding on acute liver failure patients, during rounds, or each evening, for example, before sign-out to the house staff covering at night. We thank you for viewing this instructional video and for using the Acute Liver Failure Checklist. If you have questions or comments about this video or the checklist, please contact Orrin Fix at this address.